call upon Dr. Thomas Arun Vargese to talk about breaking the bad news.
Good morning, ladies and gentlemen. At the outset, I'd like to thank Dr. Suitra and KSOS for this opportunity. Breaking bad news. Unfortunately, all of us have to do this from time to time. So what is bad news? It is a serious and adverse event which can have an influence on the patient's life and sometimes a bearing on the family as well. Fortunately, hopefully our patients, there's no threat to life, but it can include even a bad condition that they come with, for example, sudden loss of vision, and it may be a, say, central retinal vein occlusion. It is a serious event, and we have to break the bad news to the patient in such a way that they accept it and also have the right approach to it. A good rapport is very important because you never know which patient is going to turn around and bite us. So every patient, it is always to have a good rapport, and very often what we see is in the present day practice, especially the new generation, they are stuck behind the slit lamp, and very often there is no eye contact. So after you examine the patient, it is important you move the slit lamp away and have an eye-to-eye contact and chat with the patient. Understanding the patient mind. I was a patient recently, as you can see there, just a few months ago, and I really valued the way everything was explained to me. I don't think they did this because I was a doctor. The orthopedic surgeon came and saw me and said, "Your muscle is working." I had a tender Achilles avulsion. My muscle is working, but the force is not being transmitted to the foot, and so the foot is not moving. So patients really value doctors who communicate clearly and empathetically and provide thorough explanation and involve them in the decision making. So the doctor explained it to me, and these are the options that are possible, and then we made a combined decision. There are standard protocols for breaking bad news, like what is known as the CLORF framework, the 4P framework, and the most popular one is what is known as the Spikes protocol. And I'll deal with this in detail. The Spikes protocol stands for setting, the P for perception, invitation, knowledge, emotion, and summary. And we'll go through this one by one. And this is a time-tested method. And just like anything, the more we use it and practice it, the better we get at it. So the setting, just like Varma sir was saying, do not talk about things in the corridor or talk loudly to a patient in the waiting room. When you're giving a serious news to the patient, it can be, as I said, a bad diagnosis, or it can be something like a problem you had during surgery, maybe like a PC rent. You don't do it in the corridor or in the waiting room. You call the patient into your room. It is good to have a colleague of yours or maybe a senior most doctor in the hospital with you, or your paramedic, your assistant with you at that time. In this day and age, we have to be aware of our safety because we never know how a patient is going to react. So safety is of paramount importance. Also, it is good to have the decision maker in the case of the patient to be there at the same time. And it is advised that you should do this sitting down. You're both sitting down. You don't do it standing. And the chairs at 90 degrees. And people have obviously tried these different methods, and which is why they have advised these things. Moving on to the perception, it's always good to ask the patient, do they know what is the problem? For example, as I said, like a CRBO. So we said it's a problem with the blood flow in the eye. And assess their expectations and be realistic. So we cannot give exact numbers. So we have to be realistic when we explain it to them. And as I said, at each point, be guided by them in your discussion. Invitation. Even when we explain about cataract operation, some patients say, "Doctor, please do the operation." So just like that, you ask them, would they like to know what the problem is? And if so, how much would they like to know? That is the invitation. And then coming to the actual breaking bad news, the knowledge. So give a warning shot. We say we've had a small problem during surgery. Give little chunks of information. Be direct. Use plain language which they can understand. And nobody can give exact numbers or percentages. So always give a range. So the first thing they're going to ask you is, what is the chance that I'll get my vision? And you always give a percentage range. And at each point, check what they have understood. And sometimes they'll deny that there is a problem, or we have unrealistic expectations, and you have to address this accordingly. Emotion. People react differently. Initially, there may be a denial, a shock, anger, sorrow. So these are different ways people respond. We are all aware of Dr. Balaji, oncologist at Kaveri Hospital, who was unfortunately attacked by the son of a patient, who is one of his cancer patients. So be empathetic, keep calm, and as I said again, safety first. We have to keep that in mind. Acknowledge the patient's emotions, and that really makes a big difference, and make sure you listen to them. Summarize. So at the end of it, please summarize what you have said and have a strategy for the plan ahead. So I'd just like to go through this again, the spikes protocol, the setting. So make sure you're doing it in a closed room without disturbance from a mobile. Have asked what the patient knows about the problem. Invitation, how much would they like to know? Knowledge, explain in simple language, and be empathetic when you're explaining. Have a strategy and summarize and have a strategy forward. And as the patient continues to be in your care, it's a continuous process. Regularly update the patient and family members on the progress and address their concerns and involve them in the decision making. Thank you.
Thank you, Arun.